As therapists, we would have struggled. We would have struggled.
Hi, everyone. Welcome to this month's CoMaCH webinar. We've got, I think, a really exciting, very concrete conversation ahead of us today. We have four panelists. One is Wiedaad Slemming from WITS to talk about just the implementation of the Road to Health booklet, which is used in South Africa to support early childhood development and just, I guess, the tracking of babies' health and immunizations. And it has more recently been used to support health education in early childhood development. We also have Bullen and Faizah Toefy from the Bhabhisana Baby Project and Martin Weiss from Jembi Health Systems. And so we're really glad to have this set of panelists and to really be able to pull together these conversations as part of the CoMaCH network, which is co-designing community-based ICT interventions to enhance maternal and child health in South Africa. And it's a collaboration between a number of researchers from UK and South Africa. So I'm checking to see if all of our panelists are actually here. And I think we're missing two panelists. Just a moment. We'll give a few people. We've got some participants. Anne and Faizah, since you're here, I was wondering if you could introduce yourselves and talk a little bit about Bhabhisana Baby Project, and maybe we'll actually just start with your portion of the panel, just introducing and talking about how you use the Road to Health booklet. So Faizah and Anne, I've been working with as part of the CoMaCH project, but also just talking to them beforehand, and they're part of Bhabhisana Baby Project, which is this really great initiative to provide additional care and occupational therapy to premature infants, bridging that gap between when they leave the NICU and when they're able to enter into the public health system of care for these infants. And they're going to tell you a little bit more about this. So without further ado, Faizah and Anne, go ahead.
Hi everyone, I'm Anne Bullen and I'm a physiotherapist and one of the co-founders of Bhabhisana Baby Project, which, as Melissa said, we work with children with developmental delays and 0 to 2 years old. So we often see children from quite early on, sometimes as early as 2 months of age. So just talking about the Road to Health book, we use that a lot with our parents, and we love the fact that most parents, when they come to any of their appointments with their babies, will have it with them. So it's a really nice comprehensive overview of the children, as long as everyone's filling in the details. So we really love the pages at the back, the clinical notes, where people can date and write in when they see the baby. And we like the fact that it can be anyone really, and we encourage everyone to try and make a note, whether you're a doctor or a nurse or a therapist or someone in the NPO sector. It really makes a huge difference to us to get a really nice overview. So the previous Road to Health booklet had a few more pages than the new one. So we often find that we have to staple bits of paper at the back, just so that we can keep a good record of everything. And then obviously, thinking of the work that we do, the developmental pages are probably the ones that we use the most. So that's pages 22 to 25. And I'm just going to screen share page 23 and 24, which is kind of looking at developmental milestones. So we really use this a lot. And sometimes people are not so good at filling in the date or ticking the actual milestone. But in the new booklet, there's a lovely place for the date when the child reaches those milestones and a place to sign. And that's a great improvement on the previous Road to Health book. And it's very useful for us, firstly, with children that have quite severe delays. And so they're not reaching their milestones at 14 weeks or 6 months or 9 months. But over time, you can see that they are still improving. So even though they might not be reaching them at exactly the right month, they're still moving along the development milestones. And that's really encouraging for parents. And the other thing that's useful is that sometimes if a child is not reaching the next stage, they can actually look at these activities and sort of use them as a guideline of the things that they can do at home. So for example, at 9 months, throwing things, banging objects and toys, then the parents can actually encourage their children to do that. So it's a little bit of a guideline for them too. We give a much more specific program developmentally and obviously with the input of OT, physio and speech, but this is a nice general guideline for parents. And then the one thing that we do find with most of our parents that come and see us is that everyone is quite fixated on the motor skills. So as long as the child can sit and walk, stand up and then walk, parents are quite happy that their child is doing quite well. And they're not always so cognizant of the more subtle things. So this is very useful. So for example, with this child that we've filled in here, you can see at 12 months. So they're standing with support and they're picking up small objects, they're doing some imitation and understanding no, but they're not sort of, there's some gaps on the communication side and also a little bit on the understanding side. So they're not imitating different speech sounds and they don't have meaningful words. And that's quite a sort of a warning sign for us that there are some gaps, and we would like to investigate what those gaps are, whether it's a hearing issue or a visual issue or whatever. And then as the child grows up, it becomes more apparent that there are gaps specifically around communication and some of the cognitive issues. And we find this especially with children who are have developmental delays in the communication and cognitive side, often our children on the autism spectrum or children with intellectual disabilities. And so we use the Road to Health book just to kind of gently have that conversation of the gaps in the child's development and what parents can be encouraged to do. And it's also a little warning for us as to making sure that the child is in the right referral system. So that's basically, we use these pages a lot, and we really encourage everyone to fill them in whenever they see a child, because it gives us a really nice overview. Is the development delayed, or are there gaps in the child's development? So now I'm going to hand over to my colleague Faizah, who is going to chat a little bit about the weight chart, which we also use and which parents are often quite fixated on.
Thanks, Anne. So I'm Faizah. I'm a speech and language therapist at the Bhabhisana Baby Project. And so as a speech and language therapist, my focus is obviously on the development of their communication and their speech and their language. But coupled to that, and quite closely coupled to that, especially with young infants, it's the oral motor control. So how well is their mouth functioning? How well are their lips, their tongues, their swallowing, just that whole coordination. And so in young babies and infants, we can see that while they're feeding. So I do spend quite a bit of time focusing on how are they drinking if they're really little, and if they're slightly older, how are they eating. And so when we start asking those questions about how's feeding going, mommy, how's your baby feeding, you suddenly realize, and we've realized just how stressful feeding has become for many moms. And I think we sort of get a sense that moms measure their success as moms by how well their babies are thriving, and how they, and are they, you know, and how well they're gaining weight. And so when people generally make comments about, oh, why's your baby so small? Why's your baby not picking up weight? Or they go to the clinic and for the vaccination, and the nurse at the clinic says, oh, is your baby 1.5 already? And he only weighs this much. It just like adds like so many layers of stress and anxiety. And then feeding becomes quite an anxiety provoking experience for moms. And their whole day gets focused on how many moles has my baby got? He needs another 10 moles. And so the whole day gets regimented and scheduled about trying to pump in so many amounts of moles of milk or feeds for the day. And so when we find that, I'm just going to screen share
I'm going to cut you off for time soon, so quickly.
Oh, okay. So when we, you know, we then have to basically open up this book and look at the weight chart. And so we'll see where the baby's lying on the weight chart. And what I think we just think is what we try and reassure parents that is your baby following the same trajectory. If they've been prem, they obviously started off with a backlog. And so even if they haven't caught up and they're not sitting like way up there, even if they're at the bottom, but they're following that same pattern, we reassure parents that everything's okay. There are alarm bells that we look for if there are dips in the weight gain, or it's plateauing for too long, then obviously we're going to refer them on to a dietitian or to the doctors or pediatrician. But generally, if we're seeing that there is gain, and even if it's little gain, but there is gain, we try and calm them down so that feeding can start becoming an enjoyable experience where bonding and connections happen, because that is what feeding is meant to be. That whole experience is meant to be that. So that's what we try and reassure parents. So we sit with this page and we try and explain where their baby lies on this chart. And it's not about the actual weight, but it's more about the actual pattern of that gain. Okay, so that it's following the general pattern. It doesn't matter if it's lower down, but as long as it's following that pattern. And so we do spend a bit of time with this chart with mommies or the caregivers. And then the other page that we also use a lot in this book is that we try and show parents that this book is a resource for them. It's not just the book that gets taken out when they go to the clinic or to the doctor for people to write notes in. That there is valuable information in there. If your baby has a fit, if their body starts shaking, what do I do? If my baby has diarrhea for a prolonged period, what can I do? If they're struggling to breathe, what can I do? So I think we're just trying to also show parents at Bhabhisana, we're trying to show parents that this is a very useful book for them to use. Just as much as we can use it, they can use it as well. So I think that's what we try and focus on. But I think, as Anna said, there are often many of these booklets that just do not get, there are lots of gaps. And I think that we could see this baby and treat the child as a team without ever having met the team, if we all just had all our notes in that booklet, because then I'd be able to draw on the dietitian's notes, the pediatrician's notes, the therapist's notes, and we can actually work as a team, even if we have never ever seen each other. And so I think this book has got incredible potential if we use it, if we all use it the way it is meant to be used. So yeah, so I think that's from Bhabhisana. That's all we have to say. And I don't know if you have anything extra to add.
Thank you so much, Faizah and Anne. We'll have lots of time for you guys to add more, I think, in the discussion. And so I want to introduce Dr. Wiedaad Slemming, and I apologize if I've mispronounced your name. I'm trying to learn.
Perfect.
But she's a senior lecturer in the Division of Community Pediatrics at WITS. And she serves on research and technical advisory, does research and technical advisory work in the field of maternal and child health, early childhood development, childhood disability. And she serves on technical advisory groups and steering committees, including part of the development of this new Road to Health book. And so I think we're going to hear from her the implementation side of this book.
Thanks so much, Melissa. Apologies, everyone, for being a bit late. I had some power issues, but I'll share my screen and then get going. Okay, so I think Anne and Faizah did a sterling job by giving everybody quite a good overview of the book and how to use it, and also some of the potential benefits. And it's really encouraging to hear that, because that was really the intention behind revising the Road to Health book, was one, to make it more user-friendly, to make it more targeted to caregivers, to provide them with information, of which there's not that much out there for parents and caregivers per se. And so we also wanted to make it not only a tool for healthcare workers, but definitely also a tool that caregivers could use as a way to increase their own knowledge about parenting and childcare, but also as a way to almost hold health services accountable, because by reading some of the information in the booklet and seeing what needs to be done with your child at each healthcare visit, you really should be asking about your child's weight, about how your child's development is going, checking to see if there are any other needs. And so it's encouraging to hear that the book actually is being used in that way in some instances. So this booklet, as you may have heard earlier, unfortunately I missed the beginning of this presentation, was released in 2018. It really is the child's passport to access to all sorts of care. It contains all the relevant detail about the child's health and well-being. And as I said, it's an entry point for support and services both within and outside of the health system. We require this booklet to be presented at each sick and well child visit to either a clinic or a hospital, or even if the family is visited in the home. So we've come a long way. I didn't keep in all the pictures of the Road to Health booklet because I was very conscious of the length of the presentation. But, for many years we had a single chart, and then in 2009 it was revised to in line with the WHO growth charts, which were differentiated for boys and girls. And so we ended up with two books, one for boys and one for girls. And in 2018, we realized that actually we didn't need two books, we just needed differentiated growth charts. So now we have one book, which tries to be very, very hard to be gender neutral in design and color. And so really, we now have one book, but with a lot of information that's relevant to both boys and girls, and a differentiated growth charts for boys and for girls. Booklets free of charge, may not be sold, must be issued at birth, wherever the mother is giving birth. If the birth takes place at home or in a private hospital, it really should be provided to the family at the first opportunity after delivery. And it's the property of the child's parent or legal guardian, and of course the child, and not the health system or the healthcare workers. So the booklet, when it was revised, was really looking at the needs of children as opposed to the services delivered by the health system. So it was very much driven around, what are the aspects of early child development that we need to address for young children to ensure that they don't only thrive. So it's not just about survival, but also making sure that they thrive. And we wanted to make sure that all health visits are structured around these themes, whether they occur in a facility or at homes. So the 5 themes that were identified were around nutrition, and growth, love, play and talk, protection against illnesses, healthcare for sick children, and extra care for those who need it. And you'll see that there are color-coded icons, and within the book, you'll see that each section is color-coded in the same way. So it starts with a color-coded icon, as you can see, and the color continues down right, so it's easy for healthcare workers as well as caregivers to find the relevant section. It includes messages for the caregivers, but also messages for the health workers that are written in white on a blue or green background. And it's very clear where health workers are required to include information or enter information. And there's a level of accountability that's been included in this booklet around a signature and a date for anywhere where an entry is required. So we try and encourage families to personalize this booklet. Okay, so you can place a picture of the child here, they put their personal information. There's a page that explains to them how to use the booklet. It tells them what the booklet is for. And there's also a glossary. So any words that may seem unfamiliar are highlighted with a question mark. And at the back of the booklet, caregivers can go to find out what those words mean. As Faizah and alerted, there are danger signs. There's critical information that we want all parents, all caregivers, everybody to know. And in previous years, the Road to Health book only had this information on the back of the booklet. We've now included it inside because we found that caregivers tend to cover the booklets because they don't want it to break. And so then that information is lost. So we've included it inside the booklet, and these are danger signs. We want absolutely everyone to know this. And so this is critical information. So the only other thing I think, so I've highlighted some of the key changes. So around the nutrition and growth section, there's a big section on breastfeeding, but also on general nutrition. Because with the demographic and health survey data that was published in 2016, we discovered that about 3/4 of our children are being fed properly between the ages of 6 and 23 months. So really, it's not only breastfeeding that needs to improve, but also complementary feeding on the whole. For the first time ever, in the health system, we're talking about love. Okay, and love is an icon and it's there, and you actually ask, how do you love your child? How do you play with your child? How do you talk to your child? And so this is a new addition, and you heard how it's being used already in practice from Anne and Faizah. So many of the clinicians, healthcare workers who are very involved in HIV care weren't very happy with us when we tried to normalize HIV. Okay, so you'll see that in the new booklet, there's no separate section for HIV. The information is there, but it's somewhere on page 38. And also any tests that are being done to check for HIV, such as PCR tests and so on, you put it into a matrix where you can include any other information for any other tests that have been conducted. We also try to align, the links between healthcare and social care. So the section on extra care for children need a bit more help. It covers things like risk factors. Okay, it includes information on birth registration, social grants, and so on, making aware that, that when children interact with the health system, there are opportunities to link them to other avenues for support and services. Okay, so the booklet has gone out to all the districts, and really it's the districts that provide these booklets to the facilities. And it's also been aligned with community health workers' scope of practice to a large extent, where household visits are structured around the Road to Health booklet. And each of these 5 themes need to be covered when the community health worker visits the home and interacts with the mother and the child. The same way in sick child care, but also when children attend wild baby visits for routine growth monitoring and immunization. So the rollout of the booklet was supported by a national early childhood development campaign for children under the age of 5 called the Side by Side campaign. And really it's a communication campaign that airs on radio programs in 9 South African languages and on 11 public radio stations across the country. It reaches more than 4 million people in their local languages. And there's been over the years, we've been developing support materials, not only for caregivers, but also for healthcare workers on a range of the topics that are covered in the booklet. So what the booklet has allowed us to do is to really use it as a way to strengthen the health system. So we use it in many ways as an advocacy tool to look at gaps in the health services, because we're looking at a needs approach rather than a services approach. So it's not limiting us in terms of our understanding of what child health and development is. So this is the website address for Side by Side campaign. And here you can even, under the resources tab, download an electronic version of the Road to Health booklet, which can be printed off. You know, and so facilities and districts where they're running out of paper booklets, they can actually download copies and try and use it that way. We'll hear about the Road to Health booklet app in a minute. There's also COVID-19 resources and obviously a range of other resources, both for caregivers as well as healthcare workers. The only other thing is I wanted to mention is that with the rollout of the new booklet, it really demanded a paradigm shift in terms of how we view child health in South Africa. This is in line with global shifts as well as commitments that have been made in the country, national policies on early childhood development, and global strategy for women, adolescent, and children's health that we've committed to. So in terms of making sure that the booklet is used as intended and actually used effectively, as Faizah says, it really requires all the people interacting with the booklet, using the booklet as a tool, but also interacting with families, mothers, children, fathers, whoever's around their child, as a significant caregiver and adult, that we all shift our thinking, that we don't only think about survival, don't only think about growth, but we think comprehensively about all aspects. So when we see children, that we think about you know, all of these 5 themes that we've identified as being critical for children's health and well-being. Thank you.
Thank you very much. People are welcome to pop questions into either the Q&A or directly into the chat to the panelists. And just to remind you that this call is being recorded. So I want to invite Martin to talk about the digital version of the Road to Health book and some of the design that's gone into that. Martin, can you go ahead? I'll do a little introduction. Jembi Health Systems was founded in 2009, and one of their projects was to implement a digital version of this Road to Health book. They've been a core part of digital health and digital health systems in South Africa, being involved with everything from Mom Connect to you know, health information systems for South Africa. And please go ahead. Thank you, Martin, for joining us. Are you unmuted, Martin? Oh, is Martin online?
He seems to be online, but I can't, I mean, he's no mute. Or he disappeared, probably disconnect.
I think he's logging back out and coming back in. Let's see. Don has suggested a paper from New Zealand, from Clendon in, wait, what was it?
Am I back?
Yes, you're back, Martin.
Sorry, I don't know what happened there. I just dropped my line. Do you see my screen, or do I need to share it again?
You need to share it again.
Okay. Right. You see it?
Yes.
Okay, so the app was launched in 2018 by the Minister of Health, Aaron Motsoaledi. Since then, and really what this Road to Health booklet is, it's a digital version of the paper-based version of the Road to Health booklet. I will go through the features. I can do this again. And it follows the same kind of color theme and the structure and the categories as in the digital road, as in the paper-based version. What it includes is the ability for a caregiver to download the app, to install the app by themselves. What we do is we create a health account for both the mother or the caregiver as well as the infants, and use our proper electronic health records, and we provide the mechanisms for the owner, the user of the app, to be able to recover their account if they change their phone, if they change their SIM cards, if they move service providers, just like you would through a WhatsApp or Facebook. We've also included the Mom Connect notifications within the app. So pregnant expecting mothers do not have to subscribe separately to that service. And also it dramatically reduces the cost for National Department of Health. Instead of sending SMSs around Mom Connect, the messages are already embedded in the app and pop up at the appropriate times. There are two interactive tools that have been included. The one is a vaccination tracker and the other is an infant weight tracker. And I'll show you a little example of those. And then all the static information that is in the paper-based version, we've put into the digital version as well. One additional point is that this content is actually dynamic, which means that on the back end, we have a portal where we can provide access to content creators, and they can log in and they can update this content quite dynamically, and then it pushes it down to the mobile applications. For the users, for the general public that download the app, we've also included the ability for them to they can request a 10 rands voucher, top-up voucher for the data that they've consumed in downloading the app. And that automatically we work with the mobile networks and it updates their mobile account by, I think it's 10 rands worth of data. From there on, all the interactions with the back end, if they're retrieving information or if they're storing information, all of that, there's no cost to the user's mobile account. So they don't bear the cost of any of that data information. Okay, these are just some sample screens of what is in the app. As you can see, we have an administrative section where I register myself, I register my household, the children I have. I can manage the Mom Connect messages if I want to subscribe or not. And then each child has a profile. I don't have a child called ACDC, and he certainly doesn't look like that, but that's now in my Road to Health booklet. These are also just some screenshots of the vaccination tracker. So a caregiver, so this is not a healthcare worker app at the moment, it's a caregiver app, is able to log into the vaccination tracker, select their child, select what vaccination was given, provide a reason if a vaccination wasn't given, and then it would track the vaccination milestones. Again, it's quite rudimentary. It doesn't pop up and give alerts when a vaccination event is coming up, or if you've missed vaccination events. I think those are all good things that we need to build into it. The other tool is a weight graph. So again, it allows the caregiver to log in, select a child, enter a date and enter a weight, and then it will track the weight of that child on the graph. What it doesn't do, it doesn't pop up any kind of alerts, so it doesn't have any smarts to say your child is underweight or overweight, or go and see a healthcare worker. It just tracks the weight at the moment. In addition to the other categories, as mentioned previously, so I won't go into it, are all those other categories around danger signs, nutrition, those 5 pillars, including extra care for children with special needs. And then we have a section on news feeds where we can also push newsworthy information into the app as well to make it a little bit more relevant. This is just a quick video, just so you can see how interactive the app is. So you scroll down, you can select on the articles. It allows you to then browse through it. It tracks what you've seen and what you haven't seen. But again, it's static information, and we have some serious issues about the app. And while this is going in the background, I think I'll tell you. So the content is very static, you know, and as with a book, you read it once, you read it twice, you read it 3 times, you put it on the shelf. when you need it, you take it off the shelf and then you refer to it. Apps are somewhat different. You have the app on your phone, and what happens then is you don't use it. You know, you download it because you've taken your infant for an immunization, you've recorded the event, and after 3 months you haven't used the app. So Google, in its wisdom, pops up a little message and says, these 5 apps haven't been used in the last 3 months, and we see you taking more selfies. Don't you want to make more space on your phone? Delete these apps. And what happens is caregivers delete the app. And in 6 months' time or 9 months' time, when they need to then go back for another immunization vaccination, they then remember, oh, I need to download it, and they download it and they recover their account again. So, and I think one of the important things, if we could start building into this, is make it more relevant. So add additional content that comes up weekly, for example. You know, there's a lot of content being generated, but it's all over the place. There's the little radio program that was developed through the Side-by-Side campaign that could quite happily go into this kind of application as a weekly download podcast, where, you know, providers, caregivers, while traveling to work, or, you know, it's 15 minutes or 20 minutes in public transport, instead of listening to music, can listen to a series from a podcast or watch a little video clip. So make these more engaging. Let's move on. So there are updates to this Road to Health booklet that we want to build in. Things like part of the national immunization catch-up drive. I think there's a lot of content out there that can be put into the app. Maps and facility informations. Where do I get certain treatments at what facilities, and contact details for some of the facilities, and possibly even COVID information, dispelling rumors, misconceptions, where to find more information, where to get vaccinations. And I think the reason I kind of am promoting this, not because we built the app, but because it's an already sanctioned app by a National Department of Health, it's really less challenging to extend this app by putting more information in than creating 2 or 3 or 4 or 5 additional apps, and, you know, just giving users this fatigue of having to have 5 apps now on their phone instead of just 1. You know, I'm loath to put 1 app on my phone for the National Department of Health, never mind 3, but if I've got to put 1, at least give me 1 that can add additional information about HIV and TB and extend my whole health record in a single app. Other updates that we propose, that other stakeholders have proposed as well, are things like integrating into NHLS, into the laboratory system, whereby when samples are sent into the NHLS on that yellow card, the app can actually scan the lab barcode, and when the results come back from NHLS, we are able to, through the back end, pick that up and notify the mother and indicate to the mother that the results are available and that she should go back to the clinic. We want to capture the HPRN, this new health patient, the new ID number, the patient ID number. I can't remember what HPRS stands for. It's the new national identity number. We would also like secure notification, so you can send a secure message to a caregiver now, not use a public platform like a WhatsApp or a messenger, other messengers. And then again, like I said, ongoing dynamic content around PMTCT, HIV, TB, and the app can be quite intelligent and smart. It can start picking up trends. So if a caregiver has clicked on HIV information, for example, 3 or 4 times in a week, it's really simple for the app to pop up and say, hey, we notice you looking at HIV. Are you aware that this app can track your viral load? And if they say yes, we then give them the ability to enter the viral load, and we can start tracking the viral load. So it incrementally increases this longitudinal record without being intrusive and without pushing it, forcing them to engage with it. Yeah.
Encourage you to wrap up because I just want to make sure there's time for us to actually converse.
Yeah. Give me one minute.
Yeah.
Okay, so we've also built a Road to Health companion app, which is kind of a bridge between the Department of Health or the clinic and the patient. And the Road to Health companion app, sorry, that shot forward, is really a marketing tool for healthcare workers to assist mothers in assist healthcare workers in selling the concept of the Road to Health booklet to the mothers. It assists them and shows them how where to download the app from, how to register the mother's child, and it engages with the healthcare worker and provides the healthcare worker for information on how to deal with the mother. And then that opens up a whole avenue of opportunities whereby we can now have secure messaging between a healthcare worker and a mother. We can have community chats as well, where you can subscribe to a community chat, and it's closed and it's secure. So it becomes this gateway for a community health worker or for a health worker to engage with the mother through a digital mobile app. And I'll stop there, Melissa. Thank you.
Thank you so much, Martin. There's already 2 questions for you in the Q&A, so you can type answers there, or you can answer aloud, whatever works for you. But while you're looking at those, I had a question for Faizah and Anne. So you guys work directly with the paper booklet, which is blurred because of how I have my screen. Like when you look at like what Martin's company has made in terms of the Road to Health booklet, and imagine like your the parents that you work with using a phone instead of the paper Road to Health booklet, like what comes to mind? And yourselves using it, like the companion app or whatever, how, like, what's your immediate reaction?
So I think it was nice to hear that obviously parents will get some data for the downloading of the app, and that when they use the app, it's not going to use any of their data. But I would say that there are a lot of our parents who don't even have a smartphone, or they wouldn't be able to download an app, and it would be actually quite stressful for them to think of doing it electronically. So, I mean, we found our parents are very attached to that hard copy. So I should imagine that there would be quite a lot of preparation and showing them how it works, and that so maybe, Faizah, about 50% of our parents might give it a bash, but 50% of them would definitely not have access to a phone that could download an app.
And I know, yeah, go ahead, Faizah.
No, so I think that there is a group of parents who are very attached to their phones and Google and that kind of thing, and it can work for them. But I think there's definitely a section of the, you know, of our parents that I think it will be just too overwhelming and too scary. And if I press here, what will happen? So as Anne says, I think it will take a lot of preparation and training and you know, with that kind of rollout, just on how to use it, but also just actually the hardware as well. So I think it's like the hardware that they need, and then also just the training and support in making it work.
And I also mentioned it to some of the doctors that I work with, you know, in very busy clinics, and literally there's no time for getting onto somebody's app to write up clinical notes or whatever. So it's very much easier just to use the hard copy. So I think the electronic copy would be used a lot more for information and for parents to track their own child and put their own information in. It's going to be quite a big thing to get buy-in from everyone else who's providing services.
Yeah, I tend to agree. I think an app is not a silver bullet for everyone, but it certainly does I mean, it's the way the world is going, and in the next 10 to 15 years, we're all going to have these phones. Whether, you know, it'll become a utility. You'll get it. You know, when you're born, you're going to get a cell phone number, and that's it. So I think it's good to start at least. I think it's it gives the opportunity to those who have got the phone and who are urbanized and who already have got Facebook and WhatsApp and are engaging with it. I think it gives them an ability to communicate. Same with healthcare workers. I mean, the nice thing about it is that you've digitized the information, and I can just see, you know, my background is not health, it's not public health, it's not medicine, it's engineering. So I come from, you know, my perspective is somewhat a little bit different when it comes to these things. But it does, what I was going to say. So it's, I've lost my train of thought. I'll come back to that answer.
Martin, well, so I want to open up this discussion to all of the panelists. People are also welcome to pop questions into the text or into the Q&A. And because we do have a range of expertise here, from public health to more techies, and also social scientists, as well as other practitioners. And so I think having a conversation between all of us would be really helpful, just to bring in a kind of a range of insights. I was wondering, so Hafeni's asking, you know, how do you create an account? And I think you, right after she asked that, you walked through that in the screens, but I'm wondering, like, if a mom starts out in a clinic where maybe the nurses were not apprised of the app, and then the mom discovers it later, and they've already got like a paper booklet with all of the data entered, like how do they transfer? Do they have to manually copy the data from the paper Road to Health booklet into the app in order for it to like work? And then let's say when the school wants proof of immunization, will they allow you to send like a screenshot from the app instead of bringing in a scan of the immunization page on the book?
So yeah, absolutely. I mean, they're really interesting questions. So absolutely, you have to type in the information from the start, but it.
We lost him again.
Oh, we lost him. So I want to say this when Martin gets back also, but like I don't want this panel to be, you know, what are all the things that are wrong with the app, but rather I want to think about, okay, like we love digitizing things, right? And we love having, you know, apps for stuff, even though we know, like with some of our target populations, they don't have network coverage, they don't necessarily have smartphones, that when there's a smartphone in the household, it's in the hands of the father and not the mother. So there's gender issues around it. So what, like if we were to take the sort of intention of the Road to Health app, like what of that would be useful to digitize, right? Like what needs to be there? And I think Martin touched on some of this, where they would like to have more interactive, they would like to have podcasts and more up-to-date, and ability to like maybe interact and ask questions of the information that's presented to them. And so I wonder what kind of, in your experience with parents, or, you know, in literature or whatever, anybody has any input on this, like, you know, given the goals of this Road to Health booklet, like, is there a role for digitization beyond just being able to have that data digitized?
Hi, I'm sorry, I can't find my hand raising icon, but I'm Nicola. I'm from Grow Great, and thanks everyone for your presentations. I had a thought around, you know, what is it that brings users back to the app over and over again? So what is the pull? What is the kind of, what do they get out of the interaction with an app? And I think what Side by Side has done so incredibly well is the level of interaction that they've created on their Facebook page. And that's really become an online community of practice or online space where moms can ask a question, get advice from a professional, get support from other moms, get access to resources, etc. And so I think beyond just being a digital version of the app and the resources, but really a space where moms can feel supported, connected to other healthcare, connected to a health worker, connected to other moms, connected to other services. So that would be my suggestion for kind of an updated version of the app. And then just because our primary focus at Grow Great is zero stunting by 2030, and my interest in the growth charts particularly. I mean, I think there are other apps that are very easily able to indicate whether a child is underweight, overweight, stunted, etc. So whether that could also be considered in sort of an updated version, that you not only, I think that kind of prompts parents to ask for growth monitoring to happen at facility level, but then also involves them in the intervention process, which is often kind of the forgotten piece, the promotion piece. And so if yeah, so those are my 2 comments. Thank you.
I'm happy to give some opinions. I think absolutely. I think taking paper and putting it onto an app is completely useless. We lose all the functionality of a mobile device, which allows us to communicate and to share ideas and to share information. So communities, bringing communities together, I think is vital. And if you do have these communities already on Facebook, to migrate them into an app for security's sake and for sharing of information's sake, I think that's just one positive thing about the app. And it might sound like I'm pushing the app, but I am kind of pushing the app a bit, because I think apps are becoming the way that we're going to engage with the world out there. And it also allows you then to store the information without having this, this issue if I lose my documents, or if I change, move from one facility to another facility, all my information is in a phone and it's in a cloud, and I can always get access to it. So there definitely are benefits to using an app. And I'm very aware of leaving behind that population that haven't got access to this kind of technology. I don't have an answer for that. And there are probably other studies that have got much better ways of engaging with those kind of communities. So again, I don't think this is a silver bullet, but it does provide the sense of community that you can create. And those 2 things, it's curated information. So the information that I'm getting, I know is sanctioned from a National Department of Health. It's not stuff I'm finding on the internet and from, Trump's crowd on all kinds of things. It's curated by our National Department of Health, first of all. So I know where it's coming from. It's free for me, so it doesn't impact my my mobile phone, and it gives me a way to communicate back to a National Department of Health, which I think is it's quite a challenge trying to communicate back to it. And even those communities that are chatting, if you set up these kind of chat groups, it's a curated community. So you have a healthcare worker on that's able to advise. I think there are opportunities for influencers, this whole new generation of the way things are moving, where you have influencers, school kids that become the spokesman, the spokesperson, without getting politically slated.
So we have this Milk Matters app that we developed, sort of co-designing with Milk Matters NGO that does breast milk donations and their donor mothers. And the mothers really wanted to be able to chat with other donor mothers, but from an NGO perspective, there was a feeling that any chat that happened within the app, they're responsible if there's rumors, but they had no way to go and make sure that all of the kind of chat was actually aligned with health. So I mean, I think there's a big question in there about like, how do you enable peer support without simultaneously enabling, sharing of false information, right? Sharing of misinformation. And I'm not sure what the answer to that is. My other comment is, yes, I think you're right. Like, having authoritative government information is great. But when I look at the side-by-side thing and I look at your app, there's no way to take an article and share it with my friend and say, hey, this is what the Road to Health booklet says about this. Your kid has diarrhea. Like, here's how you do the ORS thing. And like, it's not easy for me to share that information. And that's actually how people are getting information. And so, I mean, I think we could, maybe think about creative ways to make apps more interactive, and to lean into that people's desire for authoritative information, I guess. Yeah, I don't know.
Could I ask another question? Is the long-term vision of this app to completely replace the paper-based version, or is this aimed at being a supplement to the paper-based version that's both patient-facing but health system-facing? Because at the moment, I think, and just seeing some of the Q&A, I think there's a little bit of a misunderstanding about what the app is currently. It's currently not meant to replace. Is that correct?
Correct. And I don't think, and it depends how long is long term. I don't see it in the foreseeable future replacing the paper-based information. And there might be opportunities when we have a national health insurance mechanism where you're going to have digitized information, otherwise you're going to really struggle in submitting claims to national health. So when that comes along, you're going to have to digitize some of this information in any case. And then to try and capture 5 years or 7 years, or I don't know when NHI is going to come in, whenever that comes in, to try and capture that information is going to be another challenge. Whereas if you've started already with a digital kind of platform, at least for the 50% that have got mobile phones and want to engage, you've got 50% of the records already recorded, and integrating we kind of base everything on our standards, which are based on the national, it's called NHSF, the National Health Normative Standards Framework. So it's interactive with that, which means that this information can be read by a provincial Department of Health, which means they get value, and it can interact with the NHI. So long term, long term, I think absolutely, I think it's all going to become digital. It's the only way we're going to be able to provide services in real time to people. Sorry, I haven't been reading the questions because I'm male. I can only do one thing at a time, so I can either listen or I can read.
I'll try and answer what I can. Do you want me to read? I can read them for you. So Hafeni asks, how much space does it take up, and what minimum phone specs required to install and use the app? And I think, actually, I was looking at it. It's like not very big, like 67 kilobytes.
No, it's about 30, I think 30 megs in total at the moment.
Okay.
Yeah, and it goes back to phones that are about 4 years old. So most apps that work on your phone today, it will work on that phone.
And I think before that, we already, I think, answered that one. And Ian Barclay asks, I wondered if data collected in the app linked into a health system backend in any way, which I think you just answered. But so if I enter vaccination data in the app, does that become part of the health system data? And does the data enter return to my phone if I delete and reinstall, which I think you said in the presentation that it does.
Yes, it does.
But like, if you go get an immunization and it gets recorded in a paper book, it's not going to show up in the app, will it?
No.
Yeah.
No, you have to add.
Yeah.
You have to add it into the electronic record. So that has to be either done by a healthcare worker who's got access to like a companion app or any other kind of access, or it has to get done on the phone.
Okay.
And there's quite a contention about who owns that record. Is this a public record? Is this a personal record? Is it my record that I give permission to a national department to share the information with, but it's my information and I give permission? Or is it a national department's record that I'm populating on their behalf?
Which in Wiedaad's presentation, she was very clear that like the Road to Health booklet belongs to the parent, right? Like that the data, everything belongs to the parent. And it's not clear to me, you know, how the national health system, I think it tracks incidents and it'll keep all the doctor's notes locally, right? And that belongs really to the national healthcare system. But if you go for private immunizations, I don't know that that's being input into the national health system at all.
So not necessarily private immunization, still a public immunization, but the record that I'm retaining on my phone belongs to me.
Yeah.
And I can share it with a doctor. I can go to a doctor and I can say, here's my phone, here's the information, or I can give them a one-time password and they can log into my account and see my information, but it belongs to me. It doesn't belong to a National Department of Health who can use it for recording or for doing analytics or for doing anything else. And there too, you know, this argument is going to and fro around the world. There are different opinions on who owns that data at the end of the day. But it's a much bigger discussion.
So Faizah, and like this issue where like half your mothers would be able to use the app and half wouldn't, is that like enough that you wouldn't use a companion app and use the smartphone app with the 50% of the mothers that you could, because you'd have to like train yourselves on it? Or how would that play out in your practice?
Yeah, so I mean, I think it would be a very interesting thing to take a couple of the moms who would be interested in something like that and play around with it. I think, you know, we both have worked in the state health system for many years, and it's so frustrating, even between state facilities, that we cannot access clinical information unless it's written down somewhere. I mean, it does seem archaic, especially in this day and age. So it feels like for health workers, it will be a huge shift to, you know, we can't even get it together to keep digital information on clients in clinics or hospitals, like to actually get them involved in actually using an app or the companion app to keep clinical data. So it's almost like we have to sort that out.
Yeah.
But we would definitely be interested in maybe just playing around with it with some of our moms who are a bit more, they've got smartphones and they might be interested in just trying.
So my sense that I have is that because, you know, like you say, Martin, if we look 10 years down the line, then this is the way to go. So it's probably better to start now, so that in 10 years time you have a better buy-in. So it's not like you're going to get the buy-in immediately, but when we look back, we'll say, oh my gosh, this process actually started 10 years ago. It took us 10 years to get here, but at least we are ahead of the pack and not starting there. So I wouldn't be opposed to the system, but I think there are going to be lots of gaps. And that paper, you know, and that our paper book is still going to be the actual passport.
Yeah.
And, you know, a couple of years ago, there was a new health facility that opened in the Western Cape, and they wanted to digitize all the record keeping. And I remember doing an outreach clinic there, and every time we got there, the electricity was off or the system was down. So we had to still write out, and then I said, but now we don't have any record of what was done previously, because we don't have access to the digital record. So I wouldn't know what was done to the patient a month ago.
Yeah.
And so it was like crazy. And so in theory, the system really looked good. And so we'd write out the record, and I said, now who's gonna know? Somebody's gonna have to retype this onto this whole system that's now down because the network is down. And this was in urban Western Cape. It wasn't in a rural town. So I mean, I that's the reality of the system. But I'm not saying that we can't start the process, because, as you say, 10 years or 20 years down the line, if this is the way it's going to go, we don't want to only start the process then and then think we 20 years further back than we could have been. So so I'm not opposed to trying the system. I'm just saying that there are going to be lots of gaps that we still going to have to try and fill in.
We have 5 more years of load shedding ahead of us. So any design needs to be able to be resilient to that. Well, I mean, I think this is a great start of a conversation. I really hope that we can continue this conversation and maybe even try, you know, playing with the Road to Health app with some of the Bhabhisana Baby Project's mothers. I have so many more questions that I want to ask, but it's already past 3, I realize. And so I'm going to ask Leanne to stop recording. Thank the speakers.